Hello everyone! Welcome again to my YouTube channel. It's me, your nurse educator, Alona, na magbibigay na naman sa inyo ng panibagong knowledge about your baby, yourself, how you can prepare habang lumalaki at lumalaki ang baby ninyo. So, I was scrolling all my messages in the past few days at maraming salamat sa mga nag-comments. Maraming salamat sa mga nag-share ng mga experiences ninyo. To my new subscribers, thank you for subscribing. At alam kong marami kayong natutunan sa mga videos ko because I want to make sure that mapapakinabangan itong YouTube platform ko na ginagamit ko ngayon. Lalong-lalo na sa mga nanay na really trying hard to make it right kung papaano alagaan sa baby at alagaan ang sarili ninyo. So, there was one of the follow-up compliment about dun sa solid food na ginawa kong video, okay? Salamat at may mga nanay na nag-message sa akin privately na nagpasalamat na nabigyan sila ng clear understanding kung ano talaga yung dapat nating ipakain sa ating mga babies, okay? Now, this is a follow-up video on that because remember in that video, I mentioned about how to feed the baby from a little platito instead of galing doon sa malaking jar or whatever container you're putting your solid food in. Kasi na-mention ko doon, when you're digging it from the jar or from that container na doon niyo ini-store yung food niyo, sometimes you cannot really calculate kung gaano kadami yung kinuha mo. But when you put it in a little platito, which is very visible in front of your eye, na makikita mo talaga gaano kadami yung kukunin mo sa kutsarita and then subo ni baby. That prevents choking. Now, speaking of choking, there was a mom who messaged me again. Thank you again for reminding me na kung po pwede ba daw i-discuss ko kung anong gagawin nyo sakaling mag-choke si baby. Okay? Me as a nurse and lactation consultant, every year talaga kami, we have to do CPR, first aid for our profession. Kailangan namin yun. Ngayon, sa mga professionals, sa mga ibang professions, hindi sila yearly talaga na up to date on how to help moms or babies when it comes to choking. Kaya itong ituturo ko sa inyo as a basic first aid na gagawin ninyo sa kasakaling knock on wood, na itong baby ninyo ay mag-choke while eating. O sakasakaling ikaw mismo nanay habang kumakain ka, or yung mother-in-law mo, or yung lola mo na matanda na nag-choke. So this is what I'm gonna tell you, show you today. Just the basic one. Dahil mahirap kasi yung i-demo ko sa inyo lahat na wala tayong manikin at wala kayo sa on the spot, that you do it on your own on how to provide first aid for your baby. So, unahin natin ang baby ngayon, okay? So, there were times in my nursing career, I was doing home visit, and isa sa mga siblings, toddlers ng nanay na binisita ko sa bahay was eating french fries. Okay? Was eating french fries. Bakit french fries ang pinakauna kong naisip? Na-example sa inyo. Kasi kalimitan sa atin, especially when we're in public places, ang pinapakain talaga natin sa mga babies when we go to fast foods ay yung french fries. Kasi you think that baby can just pick from the fries doon sa kumpol ng french fries harapan ng baby, and baby can just eat it the way it is dahil very, very easy to eat. Now, guess what? Sa karamihang nangyayari ngayon sa mga babies who got choking are eating food with big chunks of it. Okay? Big chunks of it. So, anong gagawin natin para maiwasan natin yung choking, mga hazards sa choking na yun? Always make sure when you're giving food to the baby, give little, small amount, okay? Small amount, tiny amount, okay? It's gonna take you a while feeding, pero pag nagmamadali ka dahil magagawin ka, nagluluto ka, may labada ka, you have to prioritize the feeding. Dahil pag minamadali mo ang feeding nitong baby na to, you may miscalculate kung gaano kadami na yung pinasubo mo at hindi pala nanguya ni baby na it's stored in the mouth and then you make it fuller and fuller and then nagchuchok tuloy ulit sa baby. So how can you prevent that? Again, always make sure that food texture is considered, okay? Either pureed man yun or mashed or if you have small pieces, let's say pinapakain mo si baby. Example na ito ng boiled carrots, okay? Boiled carrots. You need to cut them little pieces, okay? You need to cut them little pieces dahil little chunk of that carrots could really block the baby's airway. Okay? Now, same thing, ano pa? There are some foods that really dry to eat. Ano yun? Egg yolks. Egg yolks sa mga older babies, maybe 1 year or 2 or 1 year and a half babies na pinapakain nyo ng egg yolks. Dry yun. Minsan, it sticks to your lalamunan and then some babies get chopped. Okay? So, and then hindi sila marunong mag-cup it out, right? So, if you feel like in incident sa bahay ninyo or you're eating in a restaurant, kumain si baby ng french fries, biglang nagchuchok. The first thing you need to do is encourage the baby to cough. Yun talaga. Pero paano pag 6 months lang, 7 months old si baby? So you need to make sure to follow this step, okay? To follow these steps. So, in case of emergency na wala sa bahay ninyo na medical professional, na nurse, wala kayong kapitbahay na marunong mag-CPR, wala kayong kapitbahay na marunong mag-first aid, ito yung pinaka-basic na gagawin nito. So, if this is the baby choking, pinakain nyo ng, let's say, boiled carrots, punta tayo dun sa boiled carrots, nagto-choke si baby. Si baby is only 7 months or 8 months na hindi pa marunong mag-cough, okay? So, you need to make sure that you want this baby to cough out kung ano man yung nasa loob ng tawag nito, ng lalamunan ni baby. So, the way we were trained as a first aider, as a certified first aider, you need to hold the baby like this, see? Wag niyong ichocho, but put your hand on the baby's chest, see? Like that. Pag ganito, tapos pataob sa baby. So, you're using your thigh, okay? You're using your thigh, pataob sa baby. The reason you're doing it pataob or going, ano bang tawag nito in Tagalog? I think that's pataob. Okay, I'm sorry about my Tagalog. So, the reason why you're doing that, para mag-move forward yung nakabara sa lalamunan ni baby. And then you do slide. So, use your palm. Itong palm na to. Press it. Slide it. Slap it. Parang sinampal mo. Okay? Parang sinampal mo 5 sampal. 1, 2, 3, 4, 5. Sampal. Okay? Sampalin mo ng sampalin yung likod ni baby. Para mag-cough out si baby. Tapos turn again. Turn. If the baby is not breathing, pag si baby hindi nagbe-breathe, okay? Ito'y ginagawa lang ng mga professional. Pero kung sakasakaling knock on wood nangyayari sa bahay nyo, walang kayang katulong, mag-isa kayo, so you use your 2 fingers, itong 2 fingers na to, dito sa pinaka-sentro ng sternum ni baby, okay? Yun yung i-push nyo. Push, push, push. 5, okay? And then, do it again. You are encouraging yung air ba, na lalabas yung air, para ma-push out kung ano man yung nakabara sa lalamunan. Okay. So this step na ini-slide nyo using your palm doing this would really help the baby to cough it out. Now, let's say nakatry ka na ng 5 slapping. Okay? 5 slapping. Feeling mo pa rin hindi pa rin nagbe-breathe si baby. You look at the mouth kung may lumabas ba, or if something is sticking out inside the mouth, but never blind swipe it. Wag mo talagang iswipe yung finger mo sa loob ng bibig ng baby mo kung wala kang nakikitang something sticking out, something na lumabas. Kasi every time you do a blind swipe, ang tinatawag noon, na wala kang nakikita pero sinaswipe mo yung finger inside the baby's mouth, nagiging tuloy, you're pushing whatever food in there back into the throat. Kung iyon ang gagawin mo. So, continue again. You can do the slap again. Okay? You can do the slap. 5. And then, 1, 2, 3, 4, 5. And then slap again. 5. And then, 1, 2, 3, 4, 5. And then, hopefully si baby na-relieve na, na-cough out na, natagal. Itong baby nito, iyak ng iyak. So, it's okay for the baby to cry, okay? It's better na naiyak si baby para mailabas yung kung anumang nakabara inside, dito sa esophagus ni baby. So, alam kong minsan, kalimitan sa mga nanay, when the baby starting to choke, nagpapanik na kayo. Okay? Nagpapanik, normal yun. But don't let that panic control you. You need to take care of your baby who's choking. Okay, don't panic. The first thing, when you see your baby choking, do something about it right away. Okay, when you feel like hindi mo na talaga kaya, then sigaw ka ng tulong. Sumigaw ka. If you want, bring the baby outside your house para makita ka ng mga bahay nyo, marinig or what happened. Okay, lalo na if you're inside the bedroom. Get out, bring the baby out. Doon mo sa labas, magsigaw ka na magsigaw para may mga, but never leave your baby, okay? Never leave your baby. Do something about it. So, yung basic na tinuro ko sa inyo, okay? Will be beneficial pag kayo lang mag-isa sa bahay nyo, walang nakakaalam kung anong CPR or first aid na gagawin ninyo when it comes to baby choking. Now, kung it would be best, sa isang family, that there should be somebody who's really knowledgeable about first aid. Kailangan natin ito dahil it's not all the time takbo agad tayo sa doktor, especially if it's just a minor incident, okay? Lalo na ikaw, nanay, if you get big choke, or yung biyanan mo na matanda, nagchuchoke. So, for us, pag nagchuchoke tayo mga adult, is your fist, okay? You sit under, let's say, ikaw yung nasa harapan ko ngayon. Okay, yung nasa harapan ko ngayon na nagchuchoke ka. So, kung ako yung asawa mo, I'm gonna go around behind your back. Okay? So, I'm gonna put my arm around your back. Itong fist ko, I'm gonna put it underneath your rib cage. Okay? Yung rib cage natin. Doon ko parang, hindi ko suntukin. Okay? Hindi ko suntukin. Parang hugutin ko ng paganon. Parang i-twist ko siya na itulak ko yung hangin pataas so that you cough it out, okay? Cough it out. Yun ang gagawin ko. Or you can get this chair. I'm gonna get up, okay? I don't know if you can see it. So this chair will be useful. This is useful for you too when you're by yourself, okay? So you put your tummy dito sa chair na to and then push it up. Push it up. Push it up. Kasi pinupush mo yung air galing sa tiyan mo going up para lalabas kung ano ma yung feeling nakabara sa lalamunan mo. Now, sometimes it takes only seconds na mawalan ka na ng oxygen and sometimes you feel fainted. Okay? So, you can use this chair. Kung andyan yung asawa mo, your husband can put you at the back of the chair and pull it up like this. Okay? Using this. Okay? For pregnant women, pwede din yan. Now, for pregnant women, pwedeng ito. Yung fist natin, ang gagamitin to make sure, parang, it's not suntok, okay? Parang i-twist ko lang. Hindi ko kasi mahirap kasi pag sa video not in person. So, you just put pressure and twist it up para lang talaga malabas yung hangin going up. So, yan ang basic na knowledge na isi-share ko sa inyo. Kasi mahirap talaga pag walang manikin, mahirap na wala kayo sa harapan ko to do it on your own. But the most important thing when you see your baby choking or any of your children choking is encourage them to cough it out. Cough it out. Demonstrate how to cough it out, okay? And little pieces of food, little servings. Wag po tayong magmamadali. If you're in public places and you feel like the baby is choking, minsan kahit uminom na ng fluid, nagchuchoke na, make sure get the public attention. Yell out loud, shout out loud, my baby is choking, please help, okay? So I hope that answers the question to one of you moms who requested me. Maraming salamat for following me. Share this video dahil maraming mga nanay dyan na wala talagang knowledge on how to protect themselves, especially with their baby when it comes to choking, okay? So take care of yourself, share this video. I hope you like this video. Do your comments. Tell me what do you want to learn dahil nandito lang ako naghanda, nagpe-prepare kung anong mga turong ituturo ko sa inyo na that you get it benefits from, okay? Thanks again for watching. Bye for now. See you next video.